We're going to go over a little explanation of why we do muscle testing in the office. We have done in the past the blood analysis, urine analysis, hair analysis, salivary testing, and those tests are great for looking at disease processes or what's in the blood or whatever you're testing, but it doesn't give you a complete picture of what's going on in a live body and the physiology involved there in the body. So we found that muscle testing is a much better way of doing that because you're actually using a live body with the reflexes that are alive, and so you're not relying on a lab which can make mistakes. Everybody just assumes that what comes back from a lab is 100% accurate. Well, if you actually look into these labs, many of them are not. Also, the ranges that they use in labs to determine what is a positive or negative can also be askew. Those ranges are based on averages, so one person's average may not be the same as another person's average. So we found that many people need a lot of tweaking. They're much less than what the ranges are for a lab value. So again, they're great for disease processes, and that's great that the medics use those, but it doesn't really work for getting people actually truly healthy. So we found the muscle testing works a lot better. So I'm going to just do a quick demonstration of that, and then we'll go into other things after this. So we're just going to start by bringing the arm up, and what the idea here is to have a person hold the arm tight. So if I push on the arm and the arm is strong, that means we have a good reflex there, that the body is able to then communicate with me as what's going on, the nervous system through the brain, spinal cord, then into the muscle of the arm, the energy that goes into the muscle of the arm. So if I put pressure on that and it's strong, good. If I put pressure on it and it goes unlocked, that means that the body is not communicating with the periphery, that the body, the brain, and the innate ability of the body to heal itself is not working. And so then we have to figure out what that is. And in nutrition response testing, we have barriers, we call them, are things that don't allow the body to heal. One example of that would be a mercury toxicity. If people have mercury in the fillings of their teeth, that mercury can get into the nervous system, things don't work right, the body can't heal. So that's important, and a good example of that is if you have a cut on your hand, then normally in a week or 10 days it pretty much heals up. Well, the body should be that way too. People that have heart disease or cancer or diabetes, I mean, their body's not healing. Why not? Something's blocking that, or a barrier. So that's what we figure out then as we go into the muscle testing process a little bit farther. And how this works too with the muscle testing is it works on the theory of hypothermia. So when we're looking at that, if the body wants to keep the core alive, so in hypothermia, if you're out in the cold weather, severely cold weather, and you're tending to freeze to death, well, the body wants to keep the core alive as long as possible. It will sacrifice the fingers and toes and the appendages to keep the core alive. So when we're doing this testing and we're having a strong arm, if I irritate one of the organs or glands of the body and there's a problem there, it pulls the energy out of the arm muscle and the arm goes weak. So if I irritate, for instance, the thyroid, and that's a problem, the arm will go weak, and that tells me then that the thyroid has a problem. Then we can use nutrition then to strengthen that arm back up, which tells us then that the body likes that nutrition for that problem. So that's how we work with muscle testing to figure out what that body needs as compared to what anybody else needs. It's a very important part of figuring out how to get that body healthy. Everybody's bodies are so different, and the medical people look at everybody being the same. So they use the same blood tests and all that for just general purposes, which again is fine for disease, but we're looking at trying to fine-tune the body and get the body working at optimum. So it's so important that we figure out the individual needs of the patient, and that's what we can do in real time with nutrition response testing and the muscle testing that we do. We're getting ready to do our nutrition response testing exam, and why do we need to do that? What's the purpose of that? People come to our office and go, well, can't you just give me something for prostate, or can't you just give me something for the immune system, or can't you just give me something for heart disease? Well, there are products that we have in our lines that we carry here. We carry several lines, but there are products that work on those. They have been formulated for those. The problem is that nutrition is a lot more complicated than that. And that's why when people go to, Walmart or GNC or any of these other places, they buy a nutrition to help a certain symptom. Well, that misses the whole purpose of what nutrition is all about. And then we also wanted to make a distinction between whole food nutrition and vitamin pills. Again, vitamin pills can be used for a symptom, but that's not really the nutrition, not really helping the body to heal itself, to be strong. So the purpose of the exam is for us to ask that body, what does it need to be able to utilize and absorb these nutritions that we're going to work with. For instance, many people have digestive issues, so you can take all the good nutrition in the world, but if you're not digesting them or assimilating them, the body's not going to be able to absorb and utilize the nutrition. So it's so important that we figure out what that body needs for things to work. Again, in our earlier part that we talked with muscle testing, that if the nervous system can't communicate with the body, well then it still can't use the nutrition in the digestive system to get the body healthy. Now, many people will take vitamins and they do help a certain symptom, but again, we're going to look in a deeper level at more health and vitality, more than just trying to chase symptoms. Because many people come in here with grocery bag fulls of vitamins, and we can usually whittle that down to several or just a few, and then change their diet. Diet's an important part of this too, because again, we want to figure out what does that body work with the best diet, what foods work best with that body, because again, that's very different. People that, in my case, I come from, in my way back past, come from Northern Europe, where that area didn't have much fruit. So we live mostly on, fish and meats and things like that. Or people that have a genetic base coming from, the hotter climes, they had more fruit, so their bodies work better with that. So you got to figure out what does that body need, again, to be healthy and vital, not just to be symptom-free. That's not health. That's what the medical definition of health is symptom-free. And you're taking 10 medications to cover up symptoms. But that's not health. Health for us is getting the body to work correctly. And that's the purpose of the exams, to figure out what exactly does that body need to be healthy and vital. So now we're going to do a demonstration of the nutrition response testing technique, which gives us the ability, again, to figure out in real time what this body needs to be healthy. Now this is a snapshot of right now. So it can change in a while, but most of the time people kind of generally need the same thing. And then our goal over time, after several of these exams, is to get the body stable. We figure out their diets, get the nutritional supplements that they need and stabilized, and then that way they can just kind of go on. We don't have to check them very often. Our ultimate goal, when we first start dealing with patients, we check them weekly. But our ultimate goal is to have patients coming about 4 times a year, just to kind of see how they're doing, make sure they're not getting too many carbs and things in their diet, keep them off the processed foods, and just help them to maintain. Our society is kind of built on all these different holidays, and so people have a tendency to fall back into bad habits. Sugar, of course, is very addictive, and people have a hard time getting off of it, and it's very easy to fall back into it. So we just help patients to understand that that's not good for health. So we're going to run through our test here. So we're going to bring the arm up, and again, we talked about some of the muscle testing earlier. You can refer back to that one. But we're just going to run through the exam. So first off, I'm just going to check, make sure the arm is strong. That's good. Then we're going to check where the belly button is. We're going to check for regulation. This is another reflex, or a reflex that lets us know if the body can regulate itself. So if the arm goes unlocked, we know that the body is able to do that. With the right hand thumb and pinky tip to tip, this is a reflex we call switching. Hold, good, open. Left hand thumb and pinky, and hold, good, open that hand, good. Switching is an exam that looks at if the body is confused, the nervous system gets confused. And many times people that have like heavy metal toxicity or different things like that, their nervous system gets confused. Again, the body can't heal itself. So we want to make sure that all these pathways are open. Again, and this is another big distinctive area at nutrition response testing as compared to just buying vitamins at Walmart. Because again, you don't know any of these things are going on. You can try to take all this stuff And again, people will end up on grocery bag fulls of vitamins. So we want to just find out exactly what the body needs to be very efficient. We need just a few supplements for the body to be healthy, and again, watching the diet there too. So as we've done our first 3 tests for the autonomic nervous system and have those working well, we would normally scan the body, and what I'm going to do right now, just as a demonstration, just pick a couple organs to check. So a common one we have issues with is the top of the head, the cerebrospinal fluid, and sometimes that goes unlocked, which means that then the body is dehydrated. Thyroid is very common. We check the thyroid. If that is weak, then we know that the body's usually tired. The person is very tired. They can have hypo or hyperthyroid. The thyroid is doing too much or too little. The heart skips. We have atrial fib a lot of times comes from thyroid issues. Stomach, a lot of times people have stomach problems. Check that. If it goes unlocked, people can have ulcers and things like that. Pancreas, of course, is very common with diabetes. If that goes unlocked, we have to work on that system. The body then tells us that we have problems there. So then when we have a way of monitoring that and seeing how much energy those organs have, that we can monitor that number and get the body back to optimum numbers and then keep it there so the body can heal itself over time. Just replace everything and repair itself. So then after we've got these numbers, we put some nutrition. We've already checked the nutrition and we have kind of an idea what that body needs. Put that on the body. Again, check to make sure that the body likes it. If the arm stays strong, it does. We do another little reflex with the middle fingernail and the first crease of the thumb, which checks for the priority. If that person's priority, we're just going to demonstrate that it's the pancreas, and we'll check that good. Yeah, pancreas is still the priority. Open that hand. So that would tell me then if the pancreas is a priority for this patient, that they've had a lot of problems with sugar use over time. And again, it's because in our society we're just so geared towards sugars and stuff. We've got, like, you know, as Christmas comes up, you have to make all this fudge and cookies, and you know, Valentine's Day is all about candy and all these things. So it's very easy to fall into the sugar trap, and we just get patients to understand why that's not good. And it's not that you can never ever have it again. It's just that, you know, that's why people have problems. That's why there's so much diabetes. You know, a third of the population is diabetic or pre-diabetic. Half the population is obese, and that's all part of these issues. So we go through there, find what the body needs nutritionally, then just double check everything as we go through. We again check our regulation reflex, make sure that's open with the nutrition on the body. We have a way of dosing the amount of nutrition that body needs, and we do that every time a patient comes in. So what I'm demonstrating here really is a return visit, but it's real similar to the initial visit, but it gives us a lot of good information on what's going on, and it's in real time too. So again, a lot of the blood tests and things, but you have to wait 3 or 4 days, and by then your body could have changed quite a bit. So what we're doing here is actually a live body demonstration and a live body exam, so we know what's going on with that body at that time. Some interesting things with this: say we have a patient who is doing real well, but when they go out into the garden and then they start having all these problems, well, you can actually test patients in the garden and then find out what's going on. Or say at nighttime they don't sleep well, you can turn the lights off and then test them in a dark situation and then find out, you know, what's bothering them at night if you can't figure it out. So anyway, there are lots of ways you can use this muscle testing and nutrition response testing exam to figure out what kind of problems a person has there. So very interesting on that part. We have a way then of checking the vagus nerve to see if there's any allergies to the nutrition there. So we make sure to double check that. We can recheck all the organs to make sure they're all optimum. So, and then that's basically how this works. Gives us an idea of what that body needs, or a good exam, a good ideal there. So that's great. I think you can relax the arm. I think that's enough explanation of the nutrition response testing, the exam, and then we'll have more information about that in other ones. So what we went through then is our exam. So what we've got then, that after we do the exam, especially on the first visit, that gives us the results that we can put into our report of findings. So again, everybody's body is different. Everybody has different priorities. So as we've done our exam, we've written all this down. and found out what, again, the body's priority organ, what we're going to kind of concentrate on. We write that into a report of findings, and then the patient comes back and we go over that in detail as to what our program is going to entail, so that they know that when they start the program, they know what they have to do. So, and it's not always easy, but it eventually becomes easy as we explain why it's so important to do this if you're wanting to actually be healthy. Now again, our definition of health is a body who's vital, all the organs are working at optimum, everything is working very well, as compared to the medical definition of health is no symptoms. So it's a whole different kind of idea and philosophy is on how to do that. We're wanting to work with food and nutrition to help heal the body, so that way the body is working on the fuel that it's supposed to have. Medication is great for symptom relief and for emergencies, but it doesn't build the body. So we want to work on it in a different way to help actually heal the body so the body can be vital and live long. We know we're all mortal, but we want to live as long as we can, as well as we can, and just enjoy life that way. We want to stay out of nursing homes and just enjoy life and enjoy, kids, grandkids, and great-grandkids and all that kind of stuff. Just a quick explanation of the barriers that we talked about in an earlier video. So there's 5 barriers that we look at, and it encompasses a lot of different things. So the first barrier is looking at food allergies. And many people have food allergies due to leaky gut because of the foods they've eaten over time and the irritation in the bowel lining, which lends towards little micro holes and allows the proteins to get in there, causing an allergy response. And so if people eat every day the wrong things, they just keep inflaming themselves. So the body is just full of inflammation. They're not absorbing nutrients correctly. The bowel's irritated. All kind of problems there. Many people have digestive, most, probably 90% of the population has digestive issues, and it's because of the foods that we get into. So we have ways of helping the patients to get off of, get food allergies and sensitivities under control. The next set is our pathogens group. We're looking at viruses, bacteria, yeast, fungus, mold, and parasites. And so that covers almost all the buggies that are out there. And then these vials have lots of different energies that looks at many different forms of viruses or bacteria, whatever you're looking at there, go to a lot of things. Now these are homeopathic vials that just look at energies. They're not the actual buggy, they're just the energy of that. So that's a whole different explanation and gets pretty deep into physics and things, so we'll just kind of stay away from that. But just to realize that we're not actually using the real substance, we're using an energy there, makes it a lot easier for us to work with in the office. The next one is the metals, heavy metals. We have a whole list here of heavy metals that we can check on the body. And the 2 big ones we find, mercury is by far the most common, aluminum is very common, and then there's just all kind of other ones, arsenic and gold and all kind of, we found all kind of things in people. It's interesting to find gold because people wear gold jewelry and they have to get away from that. So we have ways, again, of detoxing the body from these heavy metals, getting the body to work correctly. And of course, mercury, that's in so many things. The big one we find in adults, the problems with that is usually the fillings in the teeth. And then for the kids, it can be the vaccines and things. We can help get that pulled out of the body, just depending if people have problems with that. So there's a lot of information that goes into that. The last group here in the boxes are chemicals. So these are like plastics, diesel fuel, formaldehyde, things like that that are in the environment that people get a hold of. They may work around this stuff. It gets into their body can't get rid of it. Then we have ways of working with other nutritionals and things to help get that pulled out of the body or help the body actually to do it itself. That's really the goal there. So that's the 4 berries in the box. The last one's even more interesting, kind of weird. Ouija is a way that we use to ask the body if there's any scars on the surface of the body that is interfering with the nervous system. The sympathetic nerves are all throughout the whole the skin, throughout the whole body. I've even heard that if you would take everything out of the body except the sympathetic nervous system, leave that there, you'd be able to recognize a person because there's just so many nerves in the body. So whenever there's a scar, that can irritate or keep that area from healing. So then we use Ouija oil to discover that. and we have ways, of course, of helping that to heal up. Some really common scars. I mean, you could imagine a person with open heart surgery, that'd be a big scar. A lot of times, like cesarean section, another real common one. Other kinds of surgeries and things like that. So we just find these scars that are, again, a barrier as to why the body can't get well, get that healed up, and then your body can go ahead and heal itself. So really good there. Then we have on the wall here, this is our display of testers that we can use to find out, again, what the body needs to be well with. We have, these are our standard process and MediHerb company, but we have several other companies that we work with because different people need different things. We also have liquids we work with for the kids that really can't take pills. So a lot of good things there. And then we have other drainage tools and other things we work with. Lots of different tools we have here to get the body to work correctly.